For more on the New South Wales pill testing trial, which is due to start next year, I'm now joined by the Director of the National Drug and Alcohol Research Centre, Professor Michael Farrell. Professor, thank you so much for your time this morning. We already have some permanent pill testing clinics set up in Canberra and Queensland. What do we know about the difference they're making to harm reduction?
Well, we know that they're possible to do and they haven't caused significant problems is the first thing, and we know that they're occurring in the context where we're more concerned about new synthetic drugs coming into the system, and it's important that we have ways to gather information about what drugs are out there and how to warn people, but also to get the message across that not everybody's taking these drugs and not everybody at festivals is, but that those who are, we have to do everything we can to minimise the risks and harms.
We know that there is overwhelming support by most health experts in favour of pill testing. It has taken governments a while to get on board. Why do you think the New South Wales government has now agreed at this point to a 12-month trial?
Well, what has been nice is to see that the government has listened to the chairs of the drug summit that occurred a few weeks ago and listened to the field in relation to the encouragement to do this and to do it in the context of also undertaking an independent evaluation so that all information will be available. So it's very welcome to see them listening and acting in a partnership way across the field.
And can you explain just how this will work in practical terms? So a festival goer turns up at a festival that has these pill testing facilities available. They have a small amount of illicit substance on them that they want to take. What are the next steps?
Well, the critical issue is if somebody does roll up to where the testing facility is, that they will be then offered the opportunity and they will get information about the contents, and ideally there's two functions of that. One is that the organisers can be aware of what types of drugs are in the system, but two is it is also establishing a contact with people and they can be given harm reduction advice and advice about if there are inherent dangers. And so some people, if for instance we are concerned, even though we've only had a small number of reports, we're concerned particularly around some adulterated drugs where we don't know what's in them that are causing overdoses, and it's important that we be able to have a way to detect those.
And obviously it's still illegal to be in possession of these drugs. So what assurances can these people having their drugs tested, what assurances do they have that they're not going to be then picked up by police as soon as they exit those testing facilities?
Well, because this is a good example where public safety is paramount, and it's a partnership between health and criminal justice where it isn't about condoning drug use or anything, but it's a partnership so that health and law can work together in an adult and mature way. And so the police are on board in relation to doing this and have agreed, as they did in the past around syringe change programs and the supervised injecting centre, which is not to focus on it and to make sure that by leaving it be, they're not disrupting the process, but they're working in partnership with the health agencies there.
Now this trial starts in February, which is a little bit of a shame in a way because it's missing a whole lot of the big festivals that we have over summer, but it will go for 12 months. How will its success be measured?
Well, I think, as the Minister said, this is not an insurance policy, so there is no silver bullets. There could be untoward events. And it's a question, I think probably the best way in first instance will be information on what drugs they're detecting, and an inference from that will be what sorts of overdoses have been prevented. There will clearly also be a measure of how many overdoses and what sorts of harms there are, but one has to interpret that quite carefully.
Okay, we'll have to leave it there, but a really interesting conversation. Thank you, Michael Farrell, Director of the National Drug and Alcohol Research Centre.
You're welcome.